Assalamu alaikum. This is the presentation for medical students by Dr. Mumtaz Ahmed Umar, and today we will just shift away from our routine topics and see some ENT Viva questions. This will be the part 1. Some confusing questions which the examiners they asked from the students, and students get confused with these questions. So we'll discuss 2 or 3 questions in this presentation. So students can be asked what is meant by OME. So OME simply means otitis media with effusion. But is this the only name this disease have? So its answer is no. So the examiner can ask what other names this disease is known for, or what other names of this disease has. So it is also known as serous otitis media, secretory otitis media, glue ear, or even mucoid otitis media. Okay, so these all are the names of this disease, which is commonly known as otitis media with effusion. Okay, the confusing question arises now. The next question which examiners ask from the student is which type of perforation this disease have. So before going the type of perforation, let us just look at the definition of OME. So OME is defined as it is the accumulation of non-purulent effusion in the middle ear cleft. Now the question can be, what is meant by middle ear cleft? So middle ear cleft, it contains the eustachian tube, the middle ear, attic, adytus, antrum, and the mastoid ear cells. Now what is the effusion means? It is an abnormal collection of fluid in hollow spaces or between the tissues of the body. So all of us know that the middle ear cavity is a space which contains air. It is an air containing space. So if we look at the different pictures of secretory otitis media, these are at different stages of the disease. So this is the starting phase. It starts with eustachian tube dysfunction. As we all know, cone of light is absent. There is slight redness in the periphery. In this picture, the air bubbles, which is pathognomic for the secretory otitis media, they are visible, and here it is dullness, and here it's bulging. It's all filled up with the fluid inside. So in all of these pictures you can visit, they are all the eardrum, they are dull looking with fluid behind the eardrum. Types of perforation. A perforation, it becomes permanent when its edges are covered by squamous epithelium and they doesn't heal spontaneously. So the perforation, in a perforation, the margins, they are epithelialized, so they will not close itself unless some procedure is carried out to close it. Perforation can be central, marginal, or attic. A central perforation is the one in which the part of tympanic membrane present all around the perforation, but the annulus is intact. So this is the main difference from the central from marginal, that in central perforation the annulus will be intact, while in marginal perforation, which most commonly occur in the posterior-superior region of the pars tensa. Okay, remember this. Central perforation also present in the pars tensa, and marginal perforation is also in the pars tensa, or part of it is in the pars tensa, but the main difference is the annulus will be involved in marginal perforation but intact in central perforation. Yes, central perforation can be of small, medium, large, or subtotal size, and its position will depend on in relation to the handle of malleus, either anterior, posterior, inferior. And attic perforation is present in the attic region. This is the animated picture of different types of perforation. if we can see, this is a small central perforation anteriorly placed. As I already said, the position is in relation to handle of malleus, so it is anterior to handle of malleus. This is inferior but medium size. This is almost subtotal. Subtotal is a little more, okay, and a large. This is basically a large central perforation. If the size increases, then it becomes subtotal. This is the attic. If you compare these, so this is the marginal. In here, the tympanic annulus, it is intact, but in marginal perforation, the tympanic annulus, it is involved. So this is the main difference between a central and a marginal perforation. So it's very important to know this point. For attic perforation, whether it is central or not, doesn't matter. Any perforation in attic region is known as attic perforation. So this is a total perforation, but in most cases of total perforation, annulus is intact. But here there may be slight, at some areas there may be destruction. So no need to tell about this thing. You just memorize small, medium, large, subtotal, marginal, attic. Okay. The actual pictures in a patient, this is a small inferior central perforation. This is a medium size, this is a large perforation. But in all these cases, this is also a type of central. The margins of the remnant of pars tensa is there, the annulus is intact, you see. But here if you see, this is the marginal perforation. Here the annulus, it is involved. This is also a marginal perforation. And this is the attic perforation covered with attic crust. Now if we see again the diagram of the otitis media with effusion, you see there is no perforation. The answer is simple, that in otitis media with effusion there is no perforation, there is no discharge. The fluid or effusion is collection of fluid. In medical terms, the effusion means collection of abnormal fluid or liquid in a hollow cavity or between the tissue spaces. So there will be no perforation. The answer is simple and straight, no perforation. So otitis media with effusion will not present with ear discharge. Okay, many students write also in the differential diagnosis of earache with ear discharge, secretory otitis media. That's wrong, because in otitis media with effusion there is no discharge. The fluid is collected behind the eardrum. The eardrum is intact. The fluid is in the middle ear. Remember this thing, this is very important. And 90% of students, the answer is, whenever they have been asked what type of perforation, they said central. And also 90% or more than 90% they write otitis media with effusion in the differentials of chronic discharging ear with earache. So open up your brains and see that otitis media with effusion means simply the abnormal collection of fluid in the middle ear cleft. There is no perforation. Earache can present, but it will be of mild nature, not severe. Okay, I hope you understand this, and don't now confuse this question. All should answer promptly and clearly. This is a very important Viva question. What is a perforation? Types of perforation? What is a marginal difference between a marginal and a central perforation? So you should now all be clear with this question. So another question, it can be little confusing that with few differences the one condition can be changed into another condition. So what are these diseases? These diseases are the Plummer-Vinson Syndrome with post-cricoid CA. Although we all know that the Plummer-Vinson Syndrome is a pre-malignant condition also for post-cricoid carcinoma. So the scenario will be the same with little difference between the both of them. So you have to consider those. If you are telling the Viva question, then you have to know about those 2 points. And even when you are attempting an scenario in OSCE paper, so you should know what clues have been given to you. So what is Plummer-Vinson syndrome? Any scenario in which it is said that a pale looking adult female ranging from 30 to 50 years presented to ENT OPD with complaint of dysphagia. Okay, so the answer is always Plummer-Vinson syndrome if the scenario is only this, along with some angular cheilitis or stomatitis or glossitis. Okay, now why this paleness is? Paleness, it is associated with iron deficiency anemia, so examination points may show also chylonychia. Okay, the examiners usually ask what is the reason for dysphagia in Plummer-Vinson syndrome. Okay, it's iron deficiency anemia, but why the patient will present with dysphagia? So the answer for that is the patient will have esophageal web. So this dysphagia is due to the formation of esophageal web. Esophageal webs are basically extension of the mucosa and submucosa of the normal esophageal tissue. Okay, so this is the picture for the esophageal web. Again, this is the endoscopic view of the esophageal web. So the one reason is mainly due to the esophageal web. The patient may complain of dysphagia. The second reason for dysphagia, because the patient's complaint will be dysphagia and pale looking. Okay, so either it may be esophageal web or there may be a growth or mass in the post-cricoid region or upper esophagus. So this web, it forms in the upper part of esophagus, just underneath the cricopharyngeus, or usually in the cervical esophagus. Okay, so if it has extended to post-cricoid CA, then this dysphagia may be due to a growth or mass, but we'll see the difference. So narrowing of the esophagus, the dysphagia, the reason for dysphagia, true dysphagia in the esophageal phase is due to narrowing of esophagus, which can either be due to stricture formation, which may be benign or malignant. It is due to the webs, which contains the mucosa and submucosa only. Esophageal rings, the rings contains the mucosa, submucosa and the muscle also. Or there may be either due to external compression from the structures in the neck or mediastinum. So webs, as already said, are often about 2 millimeter or 3 millimeter wide. They are the smooth extension of normal esophageal tissue which contains the mucosa and submucosa, while the rings, it is defined as a concentric, smooth, thin 3 to 5 millimeter extension again of the normal esophageal tissue, consisting of the three anatomical layers including the mucosa, submucosa and the muscle. Okay, so if we see, this is concentric all around. This is the esophageal ring, while in one side, usually sometimes both sides, but a smooth extension inside, it is the web. So very important question now, the main question, how to know whether it is a Plummer-Vinson syndrome or a post-cricoid cancer. So presentation and scenario will be the same. The presentation will be the same in a scenario, but two differentiating points, two main points will differentiate between a Plummer-Vinson syndrome and the post-cricoid CA. So the first is laryngeal crepitus, which will be absent laryngeal crepitus in case of post-cricoid CA. Now what is laryngeal crepitus? Laryngeal crepitus is a grating sensation which is felt by the examiner when the larynx is moved from side to side with a slight posterior pressure. So how to check? All of you, what you do, hold your larynx or Adam's apple or thyroid cartilage area between the thumb and the index finger and move it side to side. Okay, you will feel a grating pick 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 sound or sensation, which is normally present in everyone, but in cases of post-cricoid CA, it will be absent. We will not be able to move this larynx. The second point, another important point, is the palpable lymph nodes in the neck, in the cervical region. The lymph nodes, they may be palpable. Okay, any lymph node palpable with the same scenario means that it is a postcricoid CA. That's why lymph node palpation is very important part or step of routine ENT examination. Okay, so either the scenario or question contains either one of these signs or both of them. If they both are there or either one of them is there, then it means it's a postcricoid CA. So how will be the scenario came? A 40 years old female, a 40 years old pale looking female presented to ENT OPD with complaints of dysphagia for solids from the last 3 months or 1 month, 2 months, whatever. Patient has angular stomatitis and glossitis. On examination, there is level 3 lymph node palpable. Okay, or on examination the laryngeal crepitus is absent. So for both of these the answer is postcricoid CA. It is not Plummer-Vinson syndrome. Anyone writing Plummer-Vinson syndrome or telling Plummer-Vinson syndrome for this scenario is marked wrong. Okay, but for Plummer-Vinson syndrome, it is said that the same scenario, 40 years old pale looking female with angular stomatitis, cheilitis, glossitis with dysphagia, presented in ENT OPD. On examination the laryngeal crepitus is present. It means it's Plummer-Vinson syndrome. So I hope you understand this question also and will not confuse it in the future. Okay, so I'll see you inshallah next time with some other question if I got hands to it. Okay, thank you. If you have any query for any Viva question, you can write it in the comments. Assalamu alaikum.